Hey, it's Dr. Dan from Fix Me Physical Therapy, and today I'm going to talk about misinformation. And when I say misinformation, I'm not talking and I'm not saying that information is deliberately being given to you and people know that it's inaccurate. I'm actually talking about information that we've come to accept as true and that it actually isn't. As you may know from some of the videos in the past, I have a thing for statin drugs. The more I'm researching and the more research that comes out, especially after the patents have run out, we're seeing that there's some things and issues associated with the statins that we previously thought weren't an issue or didn't even think to be an issue. The same thing goes to cholesterol, high cholesterol, which again, previously, before I got into helping people reverse their type 2 diabetes, I always assumed that, you have to attack the cholesterol. Cholesterol is not good, obviously, if it's too high, but that's a response. That's your body's way of trying to heal an injury or to deal with inflammation. That's an inflammatory response. And so the correct answer isn't to get rid of the cholesterol. The correct answer is to stop what's causing the inflammation. And that goes for so many of the issues that we see. We're talking about neuropathy, type 2 diabetes, dementia, Alzheimer's. Many of these things are related to inflammation, and so often the treatments that we see or that are given and are available are downstream of the actual problem. And so they're not addressing the cause, which is up here, they're addressing the symptoms down here. And so, hey, I may feel better or the lab values may be better, but the problem is not getting better. And if best case, it's being managed. Worst case, it's continuing to cause issues. Speaking of neuropathy, there are no medications that will improve neuropathy. There are medications that will help manage the symptoms from neuropathy. But again, just speaking of the neuropathy issue, neuropathy is always progressive and degenerative. So it's always getting worse and it's going to cause damage. And at some point that damage will be irreversible. But knowing what we know and the program that we use, we can address the causes, the root cause of those problems, reverse type 2, help reverse or limit the effects of the type 2 diabetes and allow the body to heal. And as far as trusting me goes, I'm not asking, you don't need to trust me. That's perfectly fine if you don't trust me. I think you should trust but verify. So ask questions, ask lots of questions, ask for referrals, ask patients who are here about the program, ask me for numbers about past patients, all of them very willing to share their experiences because it works. And again, that's a whole host of problems. We have gut health issues, we have fibromyalgia issues. Again, all of this comes towards an inflammatory response, and that's helping heal the gut, helping reduce inflammation, all of which comes down to one thing, and that's education. And so the important thing is that if you can educate a patient so that they know exactly what's going on, exactly how they got to this point, so they know how to get to the next point, which is the goal, which we're aiming for, whether it's reversing the type 2 diabetes, losing that extra weight, getting rid of the pain associated with fibromyalgia. Whatever that goal is, you have to know what got you to that starting point, what led to those issues, and educating, and then providing a framework or a platform. In our case, we have an online platform, which allows somebody to just follow very easy daily steps. So it's not a tidal wave of things that that are just going to bury us that we have to do. It's just one thing in the morning, one thing in the evening or afternoon, one thing in the evening. Basically, you're not looking too far ahead. You're just looking right in front of you so that you know where you're going. And we already know the long-term goal, so we can focus on where we're at, which is the right now, and do the right things and make the best choices. So again, trust but verify. Do research. You're capable of reading. You're capable of making conclusions. If all else fails, you can just read the summary of the papers when you Google. When you look for them, Google Scholar has lots of medical papers, like for instance, you could do on statins and insulin resistance or statins and type 2 diabetes. You can Google that and you can look and you can read for yourself. You don't have to trust me. You don't have to trust your doctor. I mean, it's great if you do. You certainly want people on your team that you trust. And I hope that, if you choose to call us and be part of our program, that you do trust me. The results are going to be better, obviously. But you don't have to, because the truth is the truth. So it doesn't matter whether you believe or not. At the end of the day, the information that we give, and hopefully all the other people on your healthcare team gives you, is good, sound, and based on the latest research in terms of, hey, exactly what's going on. And again, we do have to unfortunately be sometimes careful, because there are conflicts of interest, not with the physicians, but with the people who provide the physicians information. We'll be talking about the pharmaceutical companies. Their interest is making money and maybe helping people, sure. But at the end of the day, they're trying to make money. And so, and certainly I want to earn a living, and the physicians need to earn a living. That all makes sense. For me, never at the cost of a patient, and never at the cost of a patient's health. So, a little bit long-winded, a little bit ranty today, so I apologize for that. But again, be your advocate, ask questions. If you have questions, ask me. You can email us. I'll put the link in the summary down below. You can give us a call. We're always here to help. Thank you for listening. And if you learned anything or got anything from this today, please hit the like button and share with friends. Thank you much.